This work was conducted because colorectal cancer is one of the most common worldwide. But the main cause of death is the development of metastasis in the liver. And to date, the only one curative option for patients is surgical resection. If resection is feasible, then the long-term survival is about 30 to 40%. But the main limitation is that only 10 to 20% of patients are suitable for resection. Mainly because metastasis can be located close to large blood vessels, or maybe because there are too much metastasis, or these metastases are so big that even if resection is feasible, then the remaining liver volume will not be sufficient to ensure survival. So for all these reasons, we decided to develop a HIFU probe that can be used during surgery in order to treat such metastasis and increase the number of patients that are treated with a curative intent. In order to treat the liver and to create large zones of ablation, we decided to change the shape of the transducer. So we do not use spherical transducer, but we suggest to use toroidal transducer. The difference is that a torus is based on the rotation of a circle about an axis of revolution, and the difference when compared with a spherical one is that the center of the circle is not placed on the axis of revolution. And in that case, we can significantly increase the focal region and then significantly increase the ablation rate up to 30 times higher when compared with conventional spherical transducers. This is the HIFU probe that has been developed based on this principle. It is composed of a HIFU emitter divided into 32 concentric rings, and in the center there's a conventional ultrasound imaging probe for guiding the treatment. This is an example of a HIFU lesion that has been created using this probe in vivo in pig liver, and we demonstrated that we can ablate up to 7 cubic centimeters of tissues in 40 seconds. By using electronic beam steering, we can further increase the ablation volume up to 50 cubic centimeters in 6 minutes and 10 seconds of treatment. Based on these results, we are now conducting a clinical study to assess the feasibility, the safety and efficacy of this technique. In phase 1 and 2A, we created HIFU lesions at distance from metastasis in part of the liver scheduled for resection in order to evaluate if we can control this ablation zone. And in phase 2B, we treat liver metastasis. The HIFU probe can be held by hand during surgery or fixed on a mechanical arm. One important finding of the phase 1/2A study is that we can clearly identify the HIFU lesions on conventional sonography with a high contrast and with a high correlation between the dimensions that have been measured in conventional sonography and the dimensions measured on gross pathology. This is an example of a 2 centimeter in diameter metastasis that has been treated in 6 minutes and 10 seconds of treatment with safety margins in all directions, and the CT scan performed 1 month after the treatment confirmed the homogeneity and the irreversible necrosis of this liver metastasis. So to date, 28 patients have been included, 11 metastases have been treated. The ablation time and the HIFU exposure sequences are adjusted according to the size of the tumor, and in all cases, we obtain safety margins of at least 5 millimeters in all directions. There was no HIFU-related complications. Histological examination confirmed the homogeneous necrosis of the liver and of the metastasis. And this toroidal HIFU device can achieve fast, selective, safe, and well-tolerated large volume of liver ablation. The average time for the HIFU procedure, including the positioning of the system, the creation of the ablation, and the evaluation on images, was 15 minutes. And we are now trying to apply this device to the treatment of the pancreas. And this is the very first result we obtained in vivo in pig with, again, large zone of ablation in the pancreas. And these ablations can be seen in real time using conventional sonography with high contrast between treated and untreated tissues. Thank you for listening.
Questions regarding this presentation?
Do you think that you're going to be able to treat any lesion in any segment of the liver? I'm thinking on for instance, the caudal lobe.
Yeah, since the treatment is performed during surgery, we have a very good access to all parts of the liver, and we try to evaluate that precisely. So we define 15 vascular targets on the liver in each patient and try to target these vessels with the probe. And the conclusion is that we can have access to 95% of the liver volume using this device.
Franco.
Okay, great presentation. I can understand that you can treat the deeper located lesions and the surgeon could agree with you. But how did you convince your surgeons to not resect the very superficial ones?
Well, in that study, we have some superficial metastasis to treat, but the aim was not to treat such kind of liver metastasis, just to demonstrate that we can safely ablate them, and then we will try to ablate juxtavascular liver tumors, which are the main goal the main difficulty for surgeons.
Okay, thanks.
And just, can you comment on the benefit of this technology over other ablative technologies?
Yeah, the main difference, if we compare with radiofrequency or cryoablation, microwaves, for example, is that there is no need to place a needle inside the liver. So we can have access to much more lesions. And another important advantage is that we clearly identify the ablated region in sonograms. And it is not the case for radiofrequency or microwave, for example.
Okay. Any other questions? Thank you very much.
Thank you.